I am Ashley Nalter, and this is the CDC's Youth Risk Behavior Surveillance Survey, focusing on mental and emotional health and how to become an advocate to help our children and our youth. So the YRBSS data summary and trends report shows a lot of different things, asks a lot of different questions, including social detriments of health, mental health, sexual behavior, substance use, violence experiences, suicidal thoughts and behaviors, and other data on behaviors and experiencings across 29 variables. The data does show a few behaviors moving in positive direction. However, there is a noticeable increase in harmful experiences among teens. The level of trauma and distress that young people are experiencing does require immediate action. Examples of risk behaviors and experiences shown in the data: nearly all groups of the youth that responded to the survey showed an increase in poor mental health along with suicidal thoughts and behaviors. Cases of experiencing violence are increasing. While substance use is still too high, it is decreasing. Some risky sexual behaviors are decreasing. However, important protective behaviors like HIV and STD testing, as well as condom usage, are also decreasing. The survey data also shows differences in the groups of students. Students experiencing the highest rates of poor mental health, violence, and suicidal thoughts and behaviors are female and LGBTQ+. While some differences between racial and ethnic groups have lessened, there are still concerning disparities in student populations. The data shows an urgent need for intervention due to suicidal thoughts and behaviors, the rates of experiencing bullying, sexual violence, and poor mental health. So just progress at a glance for mental health and suicidal variables. This is going from 2011 up through 2021. It does show that experienced persistent feelings of sadness or hopelessness is definitely a trend in the wrong direction, as is seriously considering attempting suicide, made a suicide plan, and actually even attempted suicide. All of these numbers have increased steadily over the last 10 years. The only one that didn't really change was whether they were injured in a suicide attempt and that had to be treated by a doctor or nurse. So, serious negative outcomes for health and adolescent development are the result of poor mental health. These effects obviously can last into adulthood. When young people feel hopeless about their future, they're more likely to engage in behaviors that then put them at risk for HIV, STDs, unintended pregnancy. So obviously this shows a pattern that needs to be stopped while they're still young, before they reach adulthood. So in 2021, female students, LGBTQ+, students, and students who had any same-sex partners were more likely than their peers to experience poor mental health and suicidal thoughts and behaviors. Nearly 60% of female students and nearly 70% of LGBTQ+ students experience persistent feelings of sadness or hopelessness. About 10% of female students and more than 20% of LGBTQ+ students attempted suicide. Hispanic and multiracial students were also more likely than Asian, Black, and white students to have persistent feelings of sadness or hopelessness. Black students were more likely than Asian, Hispanic, and white students to attempt suicide. So these trends show the percentage of students across every racial and ethnic group who felt persistently sad or hopelessness and how that increased. And obviously the percentage of female students who seriously considered attempting suicide, made a suicide plan, and attempted suicide increased. So I've got a few different graphs to kind of break this down just a little bit. This is the percentage of high school students who experienced persistent feelings of sadness or hopelessness during the past year of 2021 for this YRBS. So it shows again how the female students were higher, had more of an issue. And then it shows that American Indian and multiracial Hispanic, the different breakdown for the different races and how each one of those, it showed a different variable on how much that group was feeling that sadness or hopelessness, as well as breaking that down by sexual identity or sexual contacts. This next one shows different trends over the last 10 years from 2011 through 2021. The first one showing by sex, male versus female. Again, while both of those did increase and get worse as far as experiencing persistent feelings of sadness and hopelessness over the last 10 years, regardless, female still way more of an issue than it went with the male population. And then it shows the 10-year trend for Asian, Black, Hispanic, white, and multiracial communities of students, and how, again, sadly, all of those did increase, but it shows the variations over the last 10 years for each of those groups. And then I have the percentage of high school students who experienced poor mental health during the past 30 days. And again, showing that breakdown from male to female, the different races, sexual identities. So in 2021, about 22% of high school students seriously considered attempting suicide during the past year. Female students were more likely than male students to seriously consider attempting suicide. Asian students were less likely than students from most other racial and ethnic groups to seriously consider attempting suicide. LGBTQ+ students and students who had any same-sex partners were more likely than their peers to seriously consider attempting suicide. So what did I learn that showed the relating to my chosen content area for the project? So I was looking at Kentucky, which is where I live now. I moved to Kentucky in 2011, about when the two 10-year time frames that we were comparing was. Before that, I lived in West Virginia, born and raised in West Virginia. So I first tried to compare Kentucky from 2011 to 2021 and found that sadly Kentucky didn't have the mental health data for that 10-year period. So I did just decide to look at Kentucky and West Virginia, my two states that I've lived in. And in both West Virginia and Kentucky, mental health was worse than females, for females than males. But it is obviously a problem for all students. So in general, for the United States, the mental health, where they reported poor mental health, including stress, anxiety, depression, during the 30 days before the survey. It definitely shows just overall in the U.S. that females definitely have more of an issue than males, which was reflected in my home state and current state, and also reflected in the national numbers, that female numbers were always higher than male numbers. So what data was shocking to me? I found a lot shocking in this data. I was first surprised to see that I could not compare, as I mentioned, the Kentucky results from 2011 to 2021, because no data was available from 2011. It turns out that 2021 was the first year that Kentucky shows the mental health data question. It's sad to see how little mental health data has been collected and considered over the years. It's also saddening to see the state of our country's mental health for our youth in general. I had not realized that suicidal thoughts and behaviors were as prevalent as the data shows it to be. What data do you feel is the most important to know? Well, I feel like all this data is important to know. It's the future of our country, our youth. We should be keeping track of not just their dietary needs and their physical health, but their mental and emotional health as well. However, it definitely is clear that we as a country need to put a stronger emphasis on mental health concerns for our young adults and children. While I could see how the focus may be on things like drug abuse and sexual violence, I believe these problems would decrease with more of a focus on providing the support the youth needs to improve their mental and emotional well-being. So what can you use this data to guide your health education curriculum? How can you do so? Well, it's helpful to see what areas affect which groups of children and how that may vary from state to state. You can use this data to decide whether there's a greater need to focus your curriculum on something like tobacco use as opposed to dietary behaviors. Specifically with regards to mental health issues, since females tend to have more problems than males, it would be beneficial to have extra support available to the girls. You could provide additional lessons on unintentional injuries and violence with the male students, and then provide extra mental and emotional education for the girls. When students feel connected to adults that show that they care at school, they are less likely to experience negative health outcomes. The survey data shows that a strong and lifelong effect is created in areas like mental health where young people are struggling, when the school environments have programs to support positive youth development, policies and practices to support LGBTQ+ students, and properly managed classrooms, it makes a difference in their mental health. So in 2021, 61% of high school students felt close to people at school, and 86% reported that their parents or other adults in their family most of the time or always knew where they were and who they were with. About only 3% of students experienced unstable housing. Of course, we do see some disparities in the data among some groups of students. Male students are more likely than female students to feel close to people at school. White students are more likely than students from most other racial and ethnic groups to feel close to people at school. Heterosexual students and students who had only opposite sex partners were more likely than their peers to feel close to people at school. And LGBTQ2+ students and students who had any same-sex partners were more likely than their peers to experience unstable housing. So in 2021, 61% of the high school students feeling that sense of school connected, 61% of high school students felt a sense of school connectedness, which was measured by agreeing or strongly agreeing that they felt close to people at school. So overall, it's showing that whether the sex, the male versus the female, the males feeling more connection at school, different races, and how that breaks down for both the high parental monitoring and whether or not they felt close at school. So, in conclusion, this is why we need to focus on the mental and emotional well-being of our students. We can better meet the needs of our students' overall health by providing a supportive community, starting at school. As an educator, I will manage my classroom in a way that deters bullies, fosters emotional growth, and welcomes all students, regardless of their background, to a safe space where their thoughts and feelings are heard and respected. As a member of the community, I would like to work with the Site-Based Decision-Making Council to provide additional resources to our student body. Talking to an adult staff member may not be the best option for all of our students. We could create an after-school support program for students. I would also like to make sure all of our staff, students, and their families know that they can communicate with us via our various apps to keep everyone updated on what's occurring both at school and at home. I would also like to create a student group to help create good times and help the community. I would like to, with the help of some fundraising and community, be able to take some students on educational trips as well as keep them active in our community. I believe staying active and doing good deeds would be an excellent step towards creating a better mental health for our youth. So, unfortunately, we don't have a lot of funding or time during the normal school day to be able to focus on arts, humanities, music, and there are, of course, some after-school programs for high school students, like band, music classes, choir, things like that, but this is things that we could start instilling even at the elementary level and have after-school art programs where instead of going home to an empty house where they're waiting for their parents to get off work, we could be providing snacks, we could be providing a program that would allow the kids to, even if they're just sitting around and having company and talking and having time to make art, that we could then display in nursing homes and bring joy to our elders in our community. There's a lot of room for us to work with the youth to provide them a home outside of home and give them that support that they need to be able to grow emotionally and mentally into the adults that will lead us into our tomorrow. So I think this is a very crucial thing that we need to work on, and we would be needing art supplies, community building, or at least allowed to be in the school facility, and some ideas and hopefully some fundraising to be able to go on trips to local museums, learn about our community, and be doing some things with local community areas that need help. We could do a soup kitchen for the 5th graders. We could help with the nursing homes, do art, go visit and sing to the elderly, work in animal shelters. This is something where we would be helping both the students and the community at the same time. We're all a part of the same community, and we could be working together as a group to make sure the next generation of our community is as adjusted and happy as they can be going forward.